Hi guys, Ollie here and welcome back to the channel. We have reached the end of week 2 here at med school, and I actually need to clarify my titling system. Basically what I'm going to do is do a recap video at the very least at the end of every week. I've actually been here for 3 weeks. The first week was the Learning Medicine week, which is sort of, I guess, the Freshers week equivalent for most degrees. Then we had week 1 last week, the sort of first week of the proper academic term, and we have just finished week 2. It turns out that making regular vlog videos, like multiple times a week or whatever, would be way too time consuming. I kind of knew that anyway, but the amount of things that I can't actually show you due to confidentiality and things like that, that kind of gets in the way of making a reasonable quality video for you to watch. So what I've decided to do is make these recap videos, probably on the Sunday, if I have time, of every week, and just get pictures and clips and just little bits and bobs from the week, and then weave them all together at the end. The best way to get a day-to-day picture of what I'm doing is literally just read the blog on PostGradMedic.com. All the images that I'm using in these videos will be taken from there. But basically what my plan is at the moment, alongside, I will still be doing kind of interview prep, UK CAT advice, you know, medical applications videos. I do still want to do those when I have the time, but these end of the week ones are just going to be a super condensed view of my week and how everything's going at the moment. So on Monday we began week 2. I've heard from a lot of second years that week 1 and week 2 of each 6-week block are the most intense, academically speaking, and then after that it should level off just a little bit. So week 3 for me starts tomorrow, so I'll find out whether or not that's true. We carried on with our heartburn CBL patient, so in between CBL sessions we have assigned ourselves work to do so that we're prepared. We can feed back to one another when we come into the next session. So for example, between the last session, which I guess would have been Thursday of last week, and Monday, we had some research to do. My job was looking at the pharmacology of H2 receptor antagonists, which is a means of controlling stomach acid production. Histamine binds to these H2 receptors and contributes to build-up of stomach acid. And so if you use an H2 receptor antagonist, you can interfere with that binding process and stop stomach acid building up to kind of irritating levels. And there was quite an interesting surgery where you sort of take, if this is the stomach and this is the esophagus with the sphincter where my hands meet, you can take the top part of the stomach apparently and wrap it around like that. It's difficult to illustrate with my hands, but to form another sort of compression around where the lower esophageal sphincter should be to stop acid getting up into the esophagus. Also Monday, I finished this. This Is Going to Hurt by Adam Kay, who you may remember as a member of the Amateur Transplants. They were famous quite a few years ago. I was in year 6, I think, so quite a long time ago. But their most famous one, they had a very sweary cover of Going Underground by the Jam, called London Underground. So he was a medical student at the time, I think. I'm sure that was when that was. Anyway, he wrote this book, which is a collection of diary entries taken in secret while he was a junior doctor. So I think F1 through to he became a specialist registrar in obs and gynae. So it covers quite a long time. But it's a really good insight into the workings of the NHS, and I really recommend it. The hardback, for some reason, is cheaper than the paperback. It's like 5 or 6 quid on Amazon. Go and get it. It's fantastic. It's incredibly funny. I mean, he's a comedy writer now. He left the NHS. I think he writes for the BBC, but really sad as well. It's very honest, brutally honest, in fact. Give it a read. Tuesday night we had our first student seminar, which was really good. Basically you submit lectures that you want to go over to older students, and then for a couple of hours, one night a week, they will put on extra classes and go through it in their own way, sort of distilling it down to its bare bones components, like this is what you absolutely need to know in order to pass the exam, and here are some useful ways to remember the steps of mechanisms and things like that. These are absolutely fantastic. I got so much out of the session. If you come to Warwick, I really, really recommend signing up for the student-run seminars. Tuesday was also the day, I think, in which I fell asleep in an afternoon lecture. There are definitely quite a few of us on the course that are finding the transition not difficult, but just sleep. I mean, I've said before, I don't usually sleep well, but then on top of that, having these very intense days is just very challenging some days. And I actually, on Tuesday afternoon, just flat out fell asleep in one of the lectures at the back. Not because it was boring at all, I think I was finding it quite interesting, but I was just physically sort of done. On Wednesday, we actually finished our first CBL case, the heartburn patient I was talking about a second ago. We got the diagnosis, we saw an endoscopy video where we were able to look into the patient's kind of esophageal tract, and we got the diagnosis pretty much spot on, so we were really, really happy about that. I absolutely love CBL teaching. It's so different to anything I experienced during my undergrad. And I'm thinking about writing to a couple of my lecturers back at Newcastle to say, look, like, this is incredibly good as a teaching tool. Please incorporate it somehow into the undergraduate teaching, because it's just so good if you're interested. Wednesday was also when I started getting going with Anki, which is a kind of revision flashcard tool. So you use a client on PC to program in a load of front and reverse sides to cards, so you could put a question on one side or a diagram and then the answer on the other side, and then you download an app. Is it £20 on iPhone, I think. It's free on Android, so yippee for me. And it uses spaced repetition. So basically, the better you are at particular topics, the less often you'll see those sorts of cards. It kind of tailors your revision, basically, so you're always practicing what you're not good at, if that makes sense, which is really, really useful as a tool. On Wednesday evening, we actually had our medic family dinner as well, which I came this close to not going to, because over the course of Tuesday and through Wednesday, I was getting sort of fresh as flu symptoms. I had a really, really bad headache for most of the day, a runny nose, and I was just a bit snuffly. And I kind of sent a message to my medic mum, Beth, saying I probably wasn't going to come, but then Beth kind of twisted my arm a bit and got me to come along anyway. I'm really, really pleased that I did. The food was absolutely delicious. There were a few medic families there, so we got to speak to some new people, and the atmosphere was just so nice. Okay, so once again, this is Matt. He's my medic dad. This is Beth, my medic mum. This is Georgia, my medic sister. And these are not my medic family, but they're also So Thursday we started our new CBL case, which is the case that I'm currently looking at. We will carry on with it tomorrow. Patient, obviously hypothetical patient, presents with abdominal cramping and rectal bleeding. Currently taking Imodium, which doesn't really seem to be doing anything. So I will say more about this one at the end of next week, but new case, new things to look up, new anatomy to learn, all to do with the midgut and hindgut this time. We had 2 sock pop lectures that afternoon, I remember, so sort of social population perspective things, but they were all stats based, so it was talking about the differences between things like incidence, prevalence, how you calculate them, and the ways in which illness reporting is done within the NHS, sort of managing for epidemiological purposes. That was a bit of a mouthful. I think, truth be told, most people found it quite boring. I actually love stats. It's the one area of maths that I actually enjoy doing. I'm not that good at maths, but stats it's just because stats has such a practical application in the real world that I find it really interesting. And my dissertation for my undergrad degree at Newcastle, which I will talk about in a separate video, but that was virtually all stats based. So I actually found it really enjoyable. But all in all, Friday for me was definitely the highlight of the week. So firstly, these things had turned up on Thursday afternoon, so I didn't have them on Thursday. But what these are 200 milligram caffeine tablets. They were very cheap. I paid, I think, £4 for 100 tablets. But they are the equivalent dosage of caffeine of 2 cups of coffee. And you know, I'm not an advocate of taking things like that to combat lack of sleep. That's a really bad idea. Don't do that. Basically, my plan is just to keep them in my bag as kind of an emergency use situation. So if I feel myself getting drowsy, I can at least take one, and it should get me through the end of the day. I took one on Friday morning at about 7:30, and actually, I felt great. You know, I felt really energized for all the day on Friday. On Friday we were in the hospital, so we had more anatomy teaching, which was again amazing. I can't get over how good the plastinates are. They are ridiculous. Google like plastinate medical specimens or something, and the teaching staff we didn't have the same, or not exactly the same, staff teaching us. It was basically on 6 stations that you were at for, I think, 10-15 minutes, and you rotate around, and there were new people, and they were just, everyone is just so smart. It's like terrifyingly clever people, but they were really engaging. It was really enjoyable. In the afternoon, and I recommend reading my blog post for Friday afternoon, we had a clinical skills session about how to perform a general examination, and it was so good. So we were doing things like taking blood pressure, taking temperature, and doing a kind of basic physical examination, you know, looking at arteries, taking pulse readings, checking lymph nodes, examining the hands and face, things like that, using stethoscopes as well. And it sounds really stupid and infantile in a medical sense, but that was the first day that I certainly felt like a real medical student, and I think virtually everyone that I talked to about it said exactly the same thing. Because certainly most of us there, you know, already have a science degree of some sort, and we are happy about being able to learn science given adequate preparation time, because we all passed our degrees if we're here. But it's this clinical side of it, the actual application of the science that you know, but using it in the physical world to assess, you know, the patient in front of you. It's really exciting. I mean, we're all brand new to this, but you know, everyone's really like raring to get stuck in and get practicing. And I've ordered a blood pressure cuff. It's actually sat on the bed opposite me there. There's a patella hammer there as well. So I mean, we're certainly in this house, we're going to be practicing on one another, because I think that's the only way to get good at, you know, finding arteries and listening with your stethoscope and doing these examinations. It's just going to be endless hours of practice, but that's fine because we all want to be good at it. And we've got the OSCEs, so we have our formative exams at the end of each block, the sort of science side, or the lecture-based material, but we have the OSCEs as well, actual clinical assessments, so we need to be good at both. Yesterday was a pretty slow day. I basically cleaned up, did a load more Anki revision, just wrote some of my notes up generally, but Ryan's girlfriend was actually in town just for this weekend, so my housemate Ryan, she came, so we all went out for dinner, 4 of us. So it was me, Emily, Ryan, and his girlfriend Mary, and we went to Bill's in Leamington Spa, which was really nice. I'll intersperse a clip in a sec, but the food was absolutely delicious. I really recommend you go. It was quite reasonable pricing as well. But I had this dessert, which was like, it was called the chocolate bomb or something like that. It was like a hollow dome of chocolate over ice cream and little brownie pieces and honeycomb and whipped cream. all these things, and it came with a jug of hot salted caramel which you pour over the dome and it kind of melts away into the ice cream. It was just absolutely delicious. So it's Sunday now. Again, it's just been a bit quiet for me. I just wanted a relaxing weekend after going up to Manchester for the conference last time. I've been learning a new fingerstyle piece. My guitar is sat in the room over there, so I've been messing around on that a bit just to unwind a little bit. I've been reading a book by Dr. Rachel Clark, again similar diaries with the NHS thing. We're going to do some revision downstairs tonight. We've decided one night in the weekend we're going to get takeaway and, you know, pizza or Chinese or whatever, and all of us sit downstairs and go over the anatomy prep for the coming Friday, just to get stuck into it. And then there's 4 of us working on it, 'cause it's quite hard in some cases instead of 1. But guys, I've really rambled on far too long now. I'm going to have to edit all this down very, very carefully. But as always, thank you so much for watching and reading the blog. It's getting a ton of traffic at the moment, which I'm really happy about. I get emails from you guys every single day, you know, questions about studying, applying, coming to Warwick specifically, and it's so nice. I love to hear from you, and, you know, I reply to all of them. I really want to do what I can, because I remember how important it was to me, and it still is, and it really is just really gratifying to get that kind of contact. That's it for now, guys. See you next time.